All right. Well, thanks for the warm introduction, Hope. Um, I wasn't expecting that. And thanks so much for the invitation to present on practice analysis. So, I was, although now that Hope has introduced me so well, going to spend just like 1 minute introducing myself. I can see that I don't need to do that. I will say really quickly, yeah, I went to the University of Nebraska. I went through a program that I think is probably very similar to the program at UNCG. Um, I moved here right after, or right actually before I graduated. And like Hope just mentioned, I worked at Castle Worldwide for a little while. And now I work at the American Board of Pediatrics. And interestingly enough, I helped start a graduate student assistantship program, both at with UNCG, but at Castle Worldwide, which is now Measure Learning, by the way. They no longer exist as Castle, but they became Measure. And I know that there's some connections between Measure and UNCG now. But then also when I joined the ABP, I started a similar assistantship program in the relationship with UNCG, and that's been great. So over the years, I've gotten to know a handful of UNCG students pretty well, and that's been a really great thing for us. But yeah, today we're talking about practice analysis, and I thought I would try my best to cover four things. What is it? Why is it important for certification assessment? How is it actually done? Like, what does the work actually look like? And then some challenges and opportunities that I see, at least from my perspective. So I'm actually going to lump those first two bullets together for this first section of the presentation. What is practice analysis and why is it important? And so I'll jump right into that. And before even really getting into what practice analysis is, it does help to understand a little bit about who we are, the American Board of Pediatrics, and what our mission is. So our mission is to identify pediatricians who meet standards of excellence and are committed to continuous learning and improvement. So yeah, we certify pediatricians who have met standards, including passing exams. Here is a little bit more information about what it actually takes to become board certified. So in order to earn board certification, somebody actually it's sort of a long journey, right? Someone has to go to medical school, they have to graduate from medical school, they have to earn their medical license by passing the USMLE. Then, after becoming a licensed medical physician, they have to enroll in and complete an accredited pediatric residency program. And then once they've completed that accredited training program, then they're eligible to take our board certification exams. If they take those exams or that exam and they pass it, then they become board certified by the American Board of Pediatrics. And then to stay certified, there are a handful of things that I'm not going to mention in the presentation, but one of the things is engaging in continuing education. So that last bullet, the last box on the bottom here of the screen is actually referring to stuff that they have to do to stay certified as opposed to becoming initially certified. So the stuff that I am responsible for at the ABP, I work in the assessment department. I'm the director of psychometrics. And most of the work that I'm doing is focused on the certifying exam, right? So this element of board certification. And because practice analysis is so tied into exam validity, it's always nice to start out with a quick reference to the purpose of our certifying exam, which is to identify those pediatricians who do in fact possess the knowledge that is needed to provide safe and effective care. So there's the exam purpose. One of the important validity questions that we think about all the time, because we are trying to make a claim. We're trying to make the claim that our tool, our assessment, our exam is a valid tool for making decisions about whether a pediatrician possesses the knowledge needed to provide safe and effective care. So the question we're asking ourselves all the time is, or one of the questions is, how do we know that the exam is measuring the knowledge needed for safe and effective practice as a pediatrician? And the short answer to that question is practice analysis, the topic of today's presentation. It goes by different names. I would actually say that job analysis is the most common term for this line of work. We call it practice analysis at the ABP because we're dealing with pediatricians, and they refer to their jobs as like practicing as a physician and that kind of stuff. But job analysis is the much more commonly used term for this line of work. It's also called job task analysis. It's also called role delineation. But really, at the highest level, the nature of this line of work is to identify and describe the tasks that people perform in a given role or in a given job, and to identify the knowledge, skills, and abilities, the competencies, those things go by different terms, the KSAs that are needed to effectively perform those tasks. So at a high level, this is actually what practice analysis is. It's how do you go about figuring out what do people do in their jobs and what skills do they need to do that well. Um, there are a lot of job analysis methods out there. Later, I'm going to get into exactly what we do at the ABP, but just sort of at a high level, um, these are some of the common methods that people use to do this kind of work. And you can think about it, right? Like if your job or if your objective is to identify the tasks and KSAs that someone needs for their job, you could imagine doing interviews and focus groups. You could imagine sending out surveys or questionnaires to people who are currently in that type of role. You could imagine watching people do their jobs. You could ask people who are in the job to keep a log of their daily activities or their weekly activities or things like that. So there are quite a few methods, and there are many more beyond what I have listed here. Um, I will say quickly, I try to be an ethical user of AI, but I did ask AI to generate an image of me as a psychometrician, having a focus group session with a group of pediatricians, and that is the image. So the image that I put in my bio a few slides ago, I gave it that image, and I said, picture me as a psychometrician working with a team of pediatricians during a practice analysis meeting, and this was the image it generated. I liked it. It doesn't look exactly like me. It probably looks a little better than me. But it's given me a nice bow tie. I like the glasses, and I especially like how engaged and interested everyone else in the room seems to be. Like I'm doing just a fantastic job of facilitating this conversation. um, so that was nice to see. So again, I try to be an ethical user, but this was an opportunity that I took. So, where does job analysis come from? And how I see it is it's sort of an interesting intersection between IO psychology and measurement psychometrics. So, where people get a lot of training in job analysis, and by the way, I'm calling it job analysis right now. I'll eventually kind of transfer back to calling it practice analysis when I refer to the work that we do. But a lot of graduate students who come out of the IO Psych world or the IO Psych training programs, they have a lot of background and training in this line of work, and they do it for a whole bunch of reasons, right? They do it to create job descriptions. They do it to develop assessments that are used to select job applicants for a particular role. They do it for HR purposes. There's a whole bunch of reasons why IO psychology people get into this line of work. And then, of course, on the measurement and psychometric side, we often get involved in construct development. And where those two things intersect is really when we're talking about construct development for certification assessments specifically, right? You can think of if you're developing the exam blueprint or the construct for a K-12 educational assessment, you wouldn't probably follow a job analysis process to define that construct. Or if you're developing personality assessments and you're trying to define those constructs, you probably wouldn't follow a job analysis method to identify that construct. But for certification assessments specifically, and for developing our own content outlines, our test blueprints, this type of method, this process is extremely useful, and it is, by far the most widely used method to develop a construct for a certification exam. And it's not just that, and I should say, there are standards that also sort of underscore the importance of this work. And it's not, and so we don't do it just to meet the standards. But it is nice that the standards that exist out there, like the standards for educational and psychological testing, there are also standards that you may or may not be familiar with that govern um, certification programs specifically. And both of those sources really highlight that job analysis is critical. And the reason, and it's not, it's not rocket science, you'll hear me say that more than once today, is that this method does really ensure that the certification exam is linked directly to the job. That's kind of the point, which is really important for making validity arguments and validity claims about our assessments. So, how is practice analysis actually done at the AVP? I'll try to give you just a little bit of a sense of what this work looks like. So at the highest level, practice analysis is the process that we use, and the resulting output is our test blueprint. We call them content outlines. This is another area where these things go by many different names: exam specifications, test blueprints, content outlines. That's the end result. I'm actually going to be flipping a little bit back and forth, talking about content outlines, the product, and the process. But I thought it would actually be a little bit helpful if I started by giving a very quick overview of what our content outlines look like. This is like what we actually develop and come out of the process with. So for us, a content outline really serves the same purpose for our exams that an architectural blueprint serves for construction, right? This is the analogy that we tend to use with our subject matter experts when we're describing what we do. So similar to an architectural blueprint, the content outline defines what content gets in. It specifies how many items in a given topic area are on an exam form. You can think of the pile of materials that a builder might use as the pool of items without a content outline, without any structure, without any information about how to assemble a form. But using the content outline, you can put those materials, in our case, items, together in a way that is balanced and intentional and defensible, and you end up with a finished product. In our case, the exam form, but it's analogous to the finished house that a builder might produce. The way our content outlines tend to look is that they have a bunch of categories. At the highest level, we call them domains, knowledge areas. Each of those domains has a weight, and that weight identifies the percentage of exam items that cover that specific domain area. So here is a snapshot of our general pediatrics content outline. You can see that there are 24 domains. On the next slide, I'm going to mention the rheumatology domain specifically. So if you want to just take a quick note and say that, and see that domain 22, which is focused on rheumatology knowledge areas, that's 2% of our exam for general pediatrics, which is our flagship certification program, our main certification program. Drilling down into domain 22, we call these things subdomains. This particular subdomain has 7 topics, 7 subdomains. And just for your own information, our general pediatrics certifying exam is a 335 item exam. So that 2% translates to 6 or 7 items on any particular exam form. And how that would work when we're building a form is that would be roughly 1 item in each of these 7 subdomains. Again, none of the stuff that I'm showing you is rocket science, but it is sort of how it works. And I just wanted to quickly show you what content outline subdomains, what our content outlines tend to look like, and how they're structured and how they're organized before jumping back into the practice analysis process. So our practice analysis process tends to consist of 3 phases. All right. The first phase of our practice analysis is that we recruit a panel and we engage in some of that focus group methodology that I mentioned a few slides ago. We recruit a panel. We get into a handful of activities. We do discuss what does the target practitioner look like? What does a general pediatrician do? So identifying the tasks that they perform in their role. But then a really huge part of the practice analysis panel's work, and my work as a facilitator, or if it's somebody else on our team, um, is going through the current version of the content outline and making updates to it. So identifying new areas of knowledge that need to be added, taking out old areas of knowledge that are no longer relevant. But sort of at the highest level, that work can be described as developing a new draft content outline where we have only included the knowledge areas that are required for practice that are testable in a written exam format, because this particular exam is a multiple choice, sort of traditional written exam. And so we tend to focus on knowledge areas that lend themselves well to being tested in that format. And then we organize all of that knowledge into domains and subdomains. And we come out of this first phase with a draft content outline. By the way, I should have mentioned, if you have any questions at all, I'm pretty comfortable, reading the hands are raised and stopping and answering questions if that would help. I'll keep going for now, but if you have any questions about any of these things, please don't hesitate to interrupt me and ask. So that's what phase one is. It involves a panel. It involves developing a draft content outline. I did want to quickly show you, and this was a question mark. I don't know if the sound is going to come through, so I'll push play. And would somebody give me like a thumbs up if you can hear the video? And if you can't, then it's not a big deal. But I thought I would play just like 1 minute of a meeting that I had last week with the neonatology group, because I'm actually walking through this process right now with the neonatology, neonatal perinatal medicine practice analysis panel. So I'll push play again. If you can't hear the sound, then I'll just stop it because it's only a minute. You don't need to see it, but I thought it might be interesting just to kind of give you a small flavor of the work.
No, I don't think we can.
You can't hear it?
We can't.
Okay. Um, well then, it's not the end of the world. I should have tested that first, but the what I was intending to show you was just a conversation that I was having with a practice analysis panel. And what was happening was a person was basically making a comment that he wanted to remove a specific knowledge area from the content outline. Someone else was indicating that maybe it was an important concept to keep. And you kind of like hear the back and forth that panels often have as they're making decisions about what knowledge areas to include on the content outline or not. And then you can kind of see my role as the facilitator listening to these conversations, because some of my sort of main takeaways later is just sort of my own thoughts on the importance of this work and what I've personally uh, gained by being engaged in this line of work.
Andrew,
Mhm.
if you'd like us to really hear it, what you need to do probably is you have to log out. And then as you're logging in, you have to press a button that says share sound. And that would allow you. If you haven't pressed that button, it won't come through.
Let me
If
figure
you
out
if
it.
you want to do that.
Share content from camera.
You have to log out completely
Oh, log
from
out completely. Then it's
yeah.
not worth it.
So, Andrew,
Yeah,
before when you click on share at the top, are you saying include sound?
I'm clicking on it right
Besides
now.
share content before
Oh,
present
include
an
sound.
image.
Yeah, that button does
Yeah.
work. You're right. Okay, I didn't see that. Let's try it. Sorry for that.
Thank you, Dr. Michelin.
Yeah, thanks. I'm happy to have learned something about Teams. All right, let's see if this works now.
You're not sharing yet.
Oh, now I'm.
Is it gone?
Okay.
Yeah, the share button is so close to the leave button.
Oh boy. All right. Well, I will share. I will include the sound. I will share my screen. And now we should be good to go. Okay, you tell me if you can hear this.
Aspects of these
Yep.
topics.
Yep.
If that makes sense. Like, it's not really fair to ask a neonatologist how to manage preeclampsia,
Right.
like what that can do to a fetus, yes, but not antibiotics and drugs and what you're administering to the mother.
Mm-hmm.
So regarding maternal infections and maternal fetal infections, I think when we did infection, I think we kind of looked over those topics, right? I believe.
Right. I'll quickly show you what we did to the infections domain. That was domain 4. We ended up creating, so in the immunology and infectious diseases category, we created a category called congenital/perinatal/maternal infections
Perfect.
to cover all of those things.
Yeah, I think that covers the second comment. And the
Mhm.
first comment, prenatal diagnostics, images, and testing, I think it's there multiple. I think it's the fetal interventions. I think that's part of the, as well as assessment of fetal well-being.
Mhm. So, yeah, that was just a very short clip.
Complicated
And
pregnancies, obstetric conditions.
let's see. That just kind of gives a very quick view into sort of what this work looks like. It's not like the most exciting work, right? And it's not the kind of thing that I felt prepared to do coming out of my graduate program in measurement and psychometrics. Um, but I'll kind of touch on that a little bit later. So again, that was the practice analysis panel.
And
Often in this is a series of go ahead.
yeah, there's a question in the
Oh,
chat.
in the chat.
Yeah, it says, what is the typical size of the panel? And do we have panels for different domains?
What we tend to do is we tend to recruit a pretty diverse panel that represents all of the main areas of practice, if there are niched areas of practice. We tend, unless we need, sometimes we'll reach out to domain specific experts to help flesh out the subdomains in a specific domain. But often it's a panel of about 10 to 12 people, and we try to make sure that they can speak intelligently about all of the domains. And so there's some effort to recruit the right panel. But unless it's like absolutely necessary, and some certification areas, this becomes more of an issue than others, like hematology, oncology. There are people that really choose to specialize in something, and there are a lot of people that specialize in just one thing. And so finding representation for all of the domains is sometimes hard to do. But for the most part, the panels tend to be about 10 to 12 people, and often they can at least identify the topic areas and the knowledge areas that are important, even if they're not like experts in those areas. I see Mark's comment about Zoom. I tend to prefer Teams myself, but you wouldn't know it by the way this meeting is being run by me. So yeah, the first phase of the work, which is pretty involved, is getting a panel to help identify a new draft content outline. The second phase of the work is a validation survey. Really, we take that new draft content outline, and what we do at the AVP is we actually invite every single person who's board certified in that discipline to review the survey, review the new content outline, and provide some feedback. The stuff that we collect in that survey includes their own respondent characteristics. It's to help demonstrate that they're a representative sample. It's so that we can slice and dice the data later and see if there are certain domains where some practitioners think it's important, but other practitioners don't. So we do collect some respondent characteristics, practice setting kinds of questions, demographic questions, things like that. But the main body of the survey is really subdomain bullet point B here, the knowledge category ratings. We ask them to go through every single subdomain and rate those subdomains on one or several rating scales. It could be how frequently is this knowledge required in practice. It could be things like how critical is this knowledge. And we define criticality as if you didn't have the knowledge, you would cause harm, financial, physical, emotional harm, something like that. How important, that's a little bit of an easier one for people to just sort of understand and make ratings on. We do offer people the opportunity to give us open-ended feedback, like was there anything important that we missed? Or is there anything that we listed that you actually think should be removed? Things like that. And then we ask people who participate in the survey, what do you think those domain weights ought to be? And so there's an element of collecting feedback from the larger practicing community that helps shape these content outlines. That is really a truly important part of this process for us, because what that survey data does for us is it provides empirical evidence. If we ever get challenged, we can actually go back to our survey data and we can say, listen, 97% of the people who are practicing as, in this case, neonatologists, they told us that, the subdomains in domain 2 and the subdomains across the entire content outline were very important or moderately important or whatever the ratings end up being. So that's a really important part of the process for us is this survey. Then lastly, and I won't spend much time talking about this, we use that survey feedback and we make final revisions to the outline itself. So we make final revisions, we establish with our exam committees what the final weights for the new content outline will be. I will mention one thing, which is that part of the process for us after we've got a new content outline is we go through and reclassify all of the items that are currently in our bank from the old outline to the new outline so that we can start building new forms at that moment in time. And then we publish it and let everybody know, hey, we've got a new blueprint. The training program directors, they especially want to know because they're often evaluated on whether or not their graduates pass our exams. So it's really in their best interest to know if we've published a new content outline and if the exam content is changing in the future. So how are our content outlines used? And this is kind of dovetailing nice from that. The content outlines, they shape what items are written. They specify which topics items need to be written to. So they're definitely used by item writers to write items. The content outlines clearly, as I mentioned before in that analogy, determine how many items in each category need to go on an exam form. So the content outlines are directly related to form building. The content outlines are related to scoring and score reportings, in my mind, sort of in two main ways. One is the overall content outline, which identifies all the topic areas that are covered and the relative weights associated with each of those domains. To me, what that does is it produces a sampling of the universe of knowledge that could be tested or could be assessed. And it allows us to make very, I would say, solid claims about the generalizability of the scores or make accurate inferences about an individual's overall level of knowledge based on the sample of items that they received on a given exam form. So the content outline, just by existing and just by serving as the blueprint, does allow us in my mind, to make accurate inferences at the overall knowledge level. And it's important to mention that it's the overall score that determines whether or not somebody actually earns board certification or not. So that's like a very high stakes decision. The other thing the content outlines do for us is they provide a structure for giving people more detailed feedback about where they are strong and where they are weak. Right. So that's the thing that everyone wants to know. Those domain scores, as I'm sure you all know, are very unreliable. It's not very good information, but it is information that everybody wants. So we give it to them. And the content outlines are actually the organizational structure for how we go about creating subscores and reporting subscore feedback to test takers. And then exam preparation is, another thing that people use the content outlines for. Both the training programs, they will tweak their training curriculum based on what's in the content outline or not. And also individuals who are looking to take the test, they use the content outline to help know what they need to study and in their exam prep efforts. So this is like a huge, so I'll make this point, and I'm going to make it a couple of times, but you can see that like nothing about this line of work is, again, rocket science, but it is very, very important because it touches like all of the areas of the assessment, right? It touches on how we write items, it touches on how we build forms, it touches on how we produce scores, tell people whether they've passed or failed, and give them feedback about their areas of strength and weakness. And because it basically touches all areas of the assessment, it really truly is an important line of work. It's important to do it well. One last slide before kind of wrapping up here or moving into this sort of like challenges and opportunities and some personal reflections for me is just where this work, practice analysis, fits into our overall assessment cycle. Every organization has some sort of diagram like this. But practice analysis is something we do at the beginning of the cycle. Once we have that content outline finalized and available, it kicks off some item development, which then turns into form development. Then we eventually administer our exams. After the exams are administered, we do a bunch of analysis and scoring work. We tell people how they performed with our score reporting and our results reporting. And then the cycle repeats itself. In terms of timing, we do these practice analyses in a particular certification area every 5 or 6 years. And then the rest of the assessment cycle is done on a yearly basis, or in some cases, every other year. We do have some certification exams that are only administered once every other year because we have small samples. And so it's a way to lump test takers into a window where we have enough people to do some meaningful psychometric analysis. So I see that answered that question. How frequently do you perform practice analysis? About 5 to 6 years. We have 16 total certification programs that we manage at the ABP. We have general pediatrics, which is our biggest and main one, but then we have 15 pediatric subspecialties. And so with 16 certification programs and doing them on this once every 5 to 6 year schedule, that means we're doing about 2 or 3 of these projects all the time, like in a given year. Right now, I just showed you the video. We're working on neonatology, but critical care is about to start next month, and cardiology is about to start the month after that. So, yeah, I would say we do about 2, 3, 4 of these in a given year. I will probably get into, so the question is, can you speak a little bit about the type of data and processes used to help validate the content outline over time, and perhaps how the process has changed over time? I might put a pin in that question and come back to that because it's related to some of the challenges that I mentioned in some of the final slides. So why don't you help remember to ask that question again if what I say later doesn't actually address that question? How about that? Okay, so challenges and opportunities. And I only have a few slides here, and then I'd love to take your questions and chat more about this. Some of the challenges that I see with this line of work, practice analysis, is that Sometimes it is hard to get panels that are truly representative and can speak intelligently about all of the areas of practice. Another thing that I found is that because we have changed from doing this type of work in an in-person meeting over the course of like 2 or 3 days to doing it with a series of virtual meetings, sort of the nature of the world we live in, but I can tell people are multitasking. And also with virtual meetings, attendance is not always what I would hope it would be. So if there are 10, 12 members on a practice analysis panel, they're all volunteering their time, they're all doctors. It's very common for 3, 4 individuals to not attend a meeting that's, on an every other week schedule or an every month schedule, or to step out halfway through the meeting. So just getting the panel, well, first selecting a panel that is truly representative, but then also getting the panel to be engaged in the process the whole time is not an insignificant challenge. It definitely affects the work we do and I would say the quality of the work that we produce. Survey research in general is really hard to do well. We used to get response rates between 40 and 50%. Now we're lucky if we get 20%. It's probably more like in the 10 to 15% range. So that, I would say, puts a little bit of a limitation on the quality of the survey data that we get back. Timing, and this is really getting to the question that was asked before. Medicine changes quickly, and we're only updating these content outlines on a once every 5 or 6 year schedule. By the way, not everything about medicine changes quickly, but there are certain areas of medicine that change quickly. So often these content outlines, they're pretty robust to changes over time. And so I personally don't feel like we need to be updating and revising the entire content outline all of the time, because a lot of those categories are pretty broad, like rheumatology, just as a domain. General pediatricians continue to need rheumatologic knowledge, but it's the details within that domain, the subdomains and the subdomains and the specific knowledge areas within the specific medications that are used to treat the specific medical science is just advancing so quickly that it's true that there are certain areas of the blueprint that do feel like they need to change more frequently than our current cadence allows. And that's just a challenge that I would say we haven't totally figured out yet. But I will mention one thing on a slide that's coming up that gives me some optimism that we might be able to address some of that challenge. One thing I didn't really talk about, and interestingly enough, there's really no literature on this topic, at least that I've ever found, that exists in the measurement or psychometric literature. There's a lot of different ways that you can organize content in a test blueprint. To kind of elaborate on that just a little bit, we tend to organize our content domains by organ system. I didn't really call it out when I had the screenshot, but it's like, the cardiology system, the rheumatology system, but there are many ways, and often the panel will suggest other ways of organizing the knowledge categories in our content outlines. You could think of them as being organized by presenting symptoms. So rash could have been domain number 1, and chest pain could have been domain number 2, and then the subdomains underneath those things could be the diseases associated with those various symptoms. So there's a million different ways that people would like to organize the content, and I've found over time that there's no right or wrong way to do it. There's just many different ways to do it, and many pros and cons to doing it different ways. And there's not a lot of guidance for what is the best way to go about making decisions about how to organize content categories. I do actually have some optimism that AI is going to help with some of this. Not only this just immediate problem of how do you best organize the content, but the more interesting question of what exactly is the assessment measure That part, I'm a little excited to chat about in just a second. And then the other thing I'll say, and I kind of hinted at this, is that over time, as I've been doing this type of practice analysis work time and time again with many groups, um, it's very clear that there are a lot of important competencies for being a good physician, or in our case, a pediatrician, that we're not assessing very well, right? Our exam is really assessing medical knowledge, and it's doing a good job of that. But there's a million other competency areas: communication, clinical reasoning, leadership, ethical behavior, that I would say we don't do a very good job of assessing. So that goes to the claims we can make about people who eventually become board certified. So it's a pretty important challenge to at least acknowledge as we're doing this type of work and thinking about practice analysis and thinking about board certification as a whole. Some of the opportunities that I see for this work: we developed a longitudinal assessment that we call MOCA-PEDS. It's our maintenance of certification assessment in pediatrics. What this is once people become certified, they can stay certified by participating in this program. And what it involves is they get a batch of questions. It's like essentially a 15 or 20 question quiz every calendar quarter, so every 3 months, and they can answer these questions. One of the things we've done inside of this platform is that we've actually asked people, once they submit their answer, but before we tell them whether they got the question right or wrong, we ask them to rate how confident they were in their answer and how relevant that question was to their practice. And so this is actually becoming a mechanism that we might start using to supplement or maybe even replace that survey that right now is a big part of our practice analysis process. I mentioned that survey research is just harder and harder to do right now. This is potentially a mechanism, because we're collecting essentially practice analysis info, this relevance rating of all the questions. It's not rating a topic area or a knowledge area, a broad knowledge category. It's rating a specific question. But I think there is data there now that's going to help us identify which items and the topics they're tied to are relevant. And this also allows us a mechanism to see sort of trends in real time about areas, specific knowledge areas that are trending up in terms of relevance or trending down in terms of relevance. So it is potentially a way to get practice analysis data on a more real-time basis, as opposed to waiting once every 5 to 6 years to collect that kind of data. Electronic health records, it's still really hard to get that data, but if we could get access to that data, it would really, I think, have a lot of potential for telling us, because instead of sending out a survey and asking people how important is this knowledge area or how frequently do you need this knowledge area in practice, we would actually have real data about what people are actually showing up with in pediatricians' offices, what diagnosis decisions are actually being made, those kinds of things. So I would love to get our hands or develop relationships with hospitals or hospital systems that would give us this kind of data that, again, could either supplement or replace our current practice analysis survey data. And then AI, one of the things that I'm excited about is already I'm using some AI tools to just kind of develop initial drafts of things to put in front of panels and say, hey, an AI tool came up with this list of knowledge areas. What do you think? I will say there's a lot of hesitancy to trust the data that comes out of an AI model right now from pediatricians, which is interesting. But even with their hesitancy, it just saves time to give, to have a starting point and to not start from scratch. So that's just like a nice minor thing. But one of the things I'm truly interested in is potentially coming up with using AI, because this is one thing that I found that it's actually getting quite good at is, hey, here's the knowledge categories that we've currently identified. Could you reorganize them in a way that the domains are not the clinical diseases, but they're actually the presenting signs and symptoms? Or they underscore the tasks, they're related to the tasks that people perform, where the domains could be things like make a diagnostic decision. Task number 2 could be make a treatment recommendation or a treatment decision. And so my hope, and this is, I think, a line of research that we're going to start relatively soon, would be using AI to come up with multiple classification schemes and then also tag the items to those multiple classification schemes as a way to have a much fuller and much more accurate picture about what exactly it is that we are assessing with our exams. So I think there's a lot of potential there to just learn a lot, and that could have implications for the types of items we write. It could have implications for how we present sub-scores to people and tell them where they're strong and weak. So there's a lot of potential there that I'm, at least right now, optimistic about. And until we get into it, this stuff is always a little harder than you want it to be. I don't know if I fully addressed the question about how the process has changed over time. I would say the process hasn't changed that much, at least not in the time that I've been there. The ABP up until, so I started working at the ABP in 2015. Before that, I would say that this wasn't something they were doing on a regular basis at all. When I got hired, I brought this type of experience with me, and they already had a desire to start this line of work, so it just kind of worked out nicely. Um, but I would say before I got there, the ABP had been doing this kind of stuff, but it was very infrequently, once every 10 years. And for some of the certification areas, those content outlines just sort of lived until somebody raised their hand and said, we should remove this thing. It was a very informal process for how updates were made. In terms of the process itself, yeah, I would say that we've been sticking with this sort of process where we recruit a panel, develop a draft, and then administer a survey. That's more or less been the core elements of the process for a while now, but that is the thing that I would hope to change in the next, 5 years, just because of how, I don't know, difficult it's been to do survey research. And really, it's not just the data we collect might not be very accurate. It's that if we publish a paper that describes the practice analysis process and we publish those low survey response rates, it raises a lot of eyebrows just in the community. There's a PR aspect of this work that I would love to have other sources of data or other things that would allow us to make a little bit of a stronger argument that the content we're testing is truly the content that is relevant for practice. So I'm going to make one more comment and then I will stop. Well, I guess I have 2 slides, sorry. And I was already saying this, but what we would like to say as a certifying organization is that a board certified pediatrician has all of the competencies that are needed to provide safe and effective care for patients and families. I know, because I've been involved in these conversations with lots and lots of pediatricians, is that there are a lot of competency areas that we don't assess very well. But I think that's changing. And in fact, we do have a new strategic plan that got released last year, and we're now just in the early phases of implementing it. Hope's actually been helping us with some of these projects. Developing a communication skills assessment, and developing some more nuanced, or I would say alternative item types that help us get a better picture of whether someone's clinical reasoning is good or not so good or needs improvement. And so I'll just say that I'm really pleased with the direction we're moving in as an organization, because it feels like we're just now starting to go beyond what we've been doing for a really long time, which is doing a good job of assessing medical knowledge, but not so good at assessing these other areas that are also very important for practice. Final reflection. So my advisor at the University of Nebraska his name is Kurt Geisinger, and I don't know if it was his advisor when he was in graduate school or just a mentor. He was at Fordham University for a while, and so was Anna Anastasi. But when I was in grad school, Kurt would make this point to me all of the time. And he always gave credit to Anne Anastasi for this line of thinking. And this isn't a direct quote, by the way. This is my paraphrasing of what Kurt told me a million times. But it stuck with me, and it's something that I think is true. And it's this idea that it's truly essential for measurement professionals to understand psychology and understand the nature of what you're assessing, including the complex factors that impact exam performance and the way that you interpret scores. So all the behavioral contexts and all of these things that really matter. And that is partly what draws me to this line of work, practice analysis. To me, it's not super technical. I bet this is probably the least technical presentation that you've had during your measurement lab series, or this is my guess. Because the work isn't so technical, but it's really, really important work. A, because it's just foundational, it affects all the areas of measurement, but it's really helped me, I would say, understand the nature of pediatric practice, the stuff that we're assessing, the areas that we're doing a good job of assessing, and the areas that we're not doing such a good job of assessing, understanding the feedback that we give to people about how they're performing on our assessments. So for me, just personally, I've loved, I would say that I've grown more in love with practice analysis work, because it feels like it really helps me understand what it is that we're assessing, and it helps me like become a better psychometrician and make better consultation decisions about how we develop items and how we score tests and provide feedback. So I just kind of thought I'd pass that on because I always found that to be really helpful for me to kind of keep in mind as I do the other psychometric and measurement stuff that we do at the AP. So that's my final thought. I see one question in the chat. This is the time I'll stop and ask for questions. Do you try to design items targeted at different aspects of the cognitive process? We do. Right now, we tell our item writers to avoid writing recall items if they can. We focus at a higher level. These are still multiple choice questions. So for our multiple choice questions, we've kind of lumped all of the higher order classifications into just one. We call it higher order. We say, we tell our item writers, you could write a recall question or a higher order question, and please try your best to write a higher order question. And if the nature of that knowledge area is such that you just can't, it has to be a recall question, fine. But I would say 95% of the items that are written by our subject matter experts are in that higher order category. Other questions?
There was a question I don't think was answered from Matthew. It says, what are the implications of not giving the domains the same weight?
Just that the number of questions on the exam, in a particular domain area, we weight all the items the same for what it's worth. So if I show you this picture, hopefully this will make sense. Rheumatology, domain 22, that's 2% of the exam. There would be 6 or 7 questions on a 35 item exam that are related to rheumatologic knowledge. Whereas adolescent care or infectious diseases is a good example of something that we feel is more important. And that's reflected by the weight. So 7% of the exam, 7% of the items on the exam would be in the infectious disease category. So instead of 6 or 7 questions on rheumatology, you'd have probably 25 questions, 25 to 30 questions on, what's the math? Probably more like 25 questions on infectious diseases. The items themselves, though, are weighted the same. So does that answer the question? Okay.
Yeah, I think so. Okay, we have a new question from Mark. How many people per year take your largest and smallest exams?
For our certification exams, our high-stakes certification exams, the largest is about 4,000 a year. That's our general pediatrics exam. For our smallest sample exam, I think that's child abuse. Child abuse pediatrics is one of our pediatric subspecialties, and they're one of our exams that is only offered once every other year. And even with a once every 2 year exam schedule, it's 20, 25 people who take that exam once every other year. So it's a pretty small sample test.
Any more questions?
I was just wondering if, I mean, we have here graduate students who've had internships and some are getting ready to join the workforce, about how you see the allocation of time in terms, I'm speaking about your organization right now,
Mhm.
in terms of doing data analysis versus working with maybe panels on item review, moderation. So allocation of time and the types of knowledge, skills, abilities that you foresee having in somebody joining your organization at this point.
It's a good question, really good question. I would say that for the people that we hire as psychometricians, which would be the type of people that are coming out of your graduate program, I would say a majority of their time is spent on psychometric analysis. And then the two areas where psychometricians, at least at the ABP, get involved with panels of subject matter experts would be this line of work, practice analysis, and then standard setting. But in terms of the item development and the form building, we actually have a whole separate team. We have the psychometric team, which I oversee, and then we have a test development or content development team. Those individuals who run the item writing workshops and help build the forms and do all of that stuff, they tend not to have degrees in measurement or psychometrics. Often they, I don't know, fall into the field through other paths, and they're definitely not PhD level. Even if they do have experience or some sort of training in measurement or psychometrics, they often don't have PhDs. So, in terms of the psychometricians, I would say, oh, less than 50% of their time is doing this kind of work where they're involved with subject matter experts, and a majority of the time is doing item analysis, equating, scoring, score reporting, more of the technical side. So, I do think graduate programs, measurement programs are doing a fairly good job of, well, doing a really good job of preparing people for the technical work that gets done in the field. Where there is limited opportunity, this from my perspective, is these opportunities to get involved. Well, in certification testing, I get is sort of a smaller area of the larger field of measurement and psychometrics. There's just so much work that happens in K-12 testing and the other areas of testing. But I would say that it's not common for me anyway when I'm hiring a psychometrician to find somebody who's got any experience at all doing standard setting or practice analysis. But all of them have really good experience with item analysis and IRT and structural equation modeling and all of the things that are currently in the curriculum for measurement programs. And that tends to be okay because that is still the majority of the work that we ask our psychometricians to do.
Thank you.
Do we have any other questions?
If not, I'll ask another question, but I'm going to give the floor to others, give them some room.
Yeah, I think you can go ahead.
So you spoke a little bit about your ideas for the future in terms of using AI. And we do have a couple of people in the program who have been pioneering ways to utilize agentic AI for item development and so on. So I was wondering if you can speak to that point and your interest, the organization's interest, and allocations of funds and so on.
Yeah. I would say we're interested, but also resistant to change. It's been really nice having Hope around because he's, I would say, been something that we can point to and say, look at the exciting work that is being done. We are, as an organization, just in the early stages of actually exploring how to use AI for item development specifically. We've got a couple of projects that are just starting right now. One is in collaboration with our vendor, Pearson. They have an AI product that they've incorporated into their item banking software. We're going to test it out, see how it goes. And we have another like lower stakes exam where they're going to engage in a pilot study where they ask some subject matter experts to write some items with AI and some others to not, and track things like how much time does it take, what's the quality of the items, how many revisions are needed, how do they perform once they're on the exam. So we do have some plans to start pursuing that line of work, but so far like our organization specifically hasn't done a ton. We are, other than having Hope around who's been doing some pioneering work, I would say our organization is actually sort of behind the curve in that way.
Thank you.
Okay, any more questions? All right, I think that's it for today. Thank you very much, Dr. Andrew. Thank you so much for honoring our invitation. Really appreciate it. And it's very enlightening. And I'm sure a lot of us are seeing practical use of what we learn in class day to day. And I want to also extend my appreciation to the faculties, Dr. Sunasi, Dr. Kim, and Dr. Michelin for also honoring our invitation. And also the graduate students on the call. Really appreciate you. And also the evaluation students on the call. Thank you for joining in.
Well, thank you so much for having me. I really appreciate the opportunity. It's great to be invited. Great to see you all.
Yeah. So for the next session, we'll be having Dr. Shea, our new faculty, to talk to us about Mark, is it Rash? I can't remember.
Yes. Yeah, Rash model.
Yes, Rash model. So see you all in 2 weeks. Thank you.
When
very
is
much.
Dr. Kim coming?
Never.
We'll talk about that.
That's not going to happen.
All right. Thank you, Andrew.
Yep.
Thank you.
Bye, everyone. Happy Friday.
Thank
Bye.
you.